My name is Jackie Jeruss, and I'm a professor of surgery, surgical oncology at the University of Michigan. And I'm delighted to be here with my wonderful friend and colleague, Dr. Charlotte Ariyan, if you want to introduce yourself.
Yeah, sure. I'm Charlotte Ariyan. I'm an associate attending at Memorial Sloan Kettering Cancer Center in New York.
I was going to start off with an open frame discussion about how you see the role of immunotherapy impacting your practice, specifically in the care of patients with melanoma.
Well, in the care of patients with melanoma, immunotherapy has absolutely changed the entire paradigm. You know, for metastatic disease, we used to have a survival that was less than a year, and now we have patients in our most recent studies that have over half the patients are alive 5 years later. So, this has unquestionably changed our paradigm. But what's happened to us as surgeons is that we're moving into the neoadjuvant arena. There's lots of, data that maybe treating patients in a neoadjuvant fashion may be better. And so I think as surgeons, all of us are going to have to confront this. And you've heard a couple wonderful talks today looking at neoadjuvant therapy in both lung cancer and breast cancer. And certainly those results are very exciting.
Thank you for that response, and it's so exciting. I think one of the concerns, though, is as it's been articulated today, is how as surgeons, as the gatekeepers to care for many of our patients, how can we help them gain access to some of the novel therapeutics that are coming of age? How do you best recommend that we advise the American College of Surgeons constituents to do that?
Well, certainly these neoadjuvant trials are being, led in part through surgeons, and some of these are clinical trials. But if these clinical trials are positive, then it's really going to integrate into patients' practices. I mean, if you look at the data today that was presented, triple negative breast cancer, where there's clearly a need to move the needle forward, we're seeing path response rates greater than 50%, and same thing in lung cancer, path response is greater than 50%. And if these truly translate into survival benefit, then this is going to become part of the standard of care for our patients. And so as surgeons, we need to definitely be aware of things, toxicities that may affect our surgery or anything that makes the surgery more difficult. But overall, it may end up being that we're just going to all see this in the short time period.
Are there things that you think that we could be doing better in terms of how perhaps we have a conversation with our patients, and when we're starting to introduce the concept of a novel therapeutic, the way in which we may be interfacing with our colleagues in medical oncology, because so much of this work is done in collaboration with medical oncology. Are there things that you see as a leader in melanoma care and a thought leader in immunotherapy, how we best can find ways to collaborate?
Well, I mean, I think as you highlighted, it's really an integration of multiple specialties. For many years, surgery was the only game in town, in cancer care. And now systemic therapies are becoming more effective, more targeted, more personalized. And so I think what a surgeon brings to the table is an opportunity to work even more closely with our medical oncologist. You're going to get a sense when you operate on that patient, if they're responding, if they're not responding. You're going to see the different pathology. And certainly you have something to add to that story about the patient. And really, it's a very powerful in vivo, or each individual patient, it's a very powerful test of whether this is good for them or not good for them. And so I think surgeons really have the opportunity to come together and provide more data. Of course, the tissue is going to be a collaborative effort, and there's lots of studies that can be done about that to try to quantify why people respond and don't respond. But overall, it's an opportunity to bring things together even more.
Is there anything else you want to add in terms of the discussion in regard to the talks that we've heard, or your involvement at the forefront of this novel therapy?
No, I think you've heard excellent talks today that have really highlighted the fact that there are these tumor antigens that your immune system can see, that, combining therapies, again, on a backbone of standard therapy with immune therapy is showing great promise in diseases that we didn't think were as sensitive to immune therapy, like triple negative breast cancer, and providing a lot of hope. So I think that we will use this experience to continue to move the needle forward, and these are exciting times.
I agree. And again, thanks so much for your time today and for your willingness to participate in this interview, and all of our panelists who we've learned so much from. And stay tuned. I feel like this is such an exciting part of the opportunity for us to be involved in surgical care and medical care for our patients.
Yes, and thank you to the presenters.